you still have to have yourself checked. Whether that if you have a feeling that it's in your family, the genes are there or not, still have yourself checked.
So the earlier you detect it, not only will you have the benefit of a higher survival rate, but the cost would be kept at a lower level.
Breast cancer remains to be the most common cancer among women, especially here in the Philippines. But proper awareness and early detection can make a very significant difference. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk. Breast cancer continues to be a common problem, not just here, but around the world. Now, to talk more about this topic, let's welcome our guests. We have Nicoy De Guzman. She's a breast cancer survivor and the president of iCancer Foundation, which is a nonprofit organization that provides people with information about breast cancer and also empowers women living with this condition. Joining us as well is Dr. Joseph Thomas Noriega. He's a board-certified breast surgeon from the Asian Hospital and Medical Center and a member of the Philippine Society of Breast Surgeons. Hello and welcome, Nicoy and Doc JT. Now, first and foremost, let's start off the discussion with statistics. Earlier, I mentioned how breast cancer is common. Let's talk about numbers. Doc JT, gaano ba ka-common talaga ang breast cancer?
Breast cancer is actually the most common cancer in the world. Okay? It surpassed lung cancer in 2020, grabbing the crown and becoming the most common.
Now, dito sa Pilipinas, number 1 din siya. Is there any reason why this is? Is there something about Filipinos na napaka-common ng breast cancer sa atin?
No, not really. It's most of the countries actually. The most common cancer is still breast cancer, and it doesn't. The Philippines also.
A lot of people, when they hear the word breast cancer, they think of just one sex mostly having breast cancer, but breast cancer does not discriminate. Let's talk about that. Both men and women can have breast cancer. Let's talk about that. Let's talk about the factors kung bakit nagkakaroon ng breast cancer sa tao.
99% of breast cancer patients are women, 1% are male. Okay, there are certain risk factors that involve a person getting breast cancer, and these are divided in two: those that you cannot control and those that you can control. Those you cannot control, of course, if you're a female, age, family history of breast cancer, early menstruation, menopause, these are risk factors that you cannot control.
Right.
And then you have risk factors that you may control a bit, like pregnancy. The more pregnancies you have in life, the lesser the chance. Lifestyle, like obesity, sedentary lifestyle, smoking, and alcohol. The more you do these things, the higher the risk factor.
So marami talagang factors, Doc JT, ano? We will go through that later on in the show para mas maliwanagan ng ating mga viewers. Which is why I would like to ask Nicoy, how important is it that people know about these factors, are more educated, more knowledgeable with breast cancer, especially now that we're celebrating Breast Cancer Awareness Month?
Breast cancer is really high in the Philippines. Well, not just in the Philippines, but it's a global thing that the incidence is really high. And we at iCancer really push for early detection and really knowing a lot about breast cancer, because we want to remove the stigma also that it is a death sentence. Many people are scared of it, but with early detection, this becomes manageable. So we really want more people to know what I may say, the ins and outs of breast cancer, the possible treatments, and the like.
Doc JT, now let's talk about how breast cancer does not discriminate. You mentioned earlier how breast cancer can affect men, although a smaller percentage, pero may risk pa rin. Let's talk about that.
We all know that the highest incidence usually happens at around 50 or 60 years old, generally speaking. But take note that women who are very young can also have breast cancer. In their 20s, even teenagers can have breast cancer. And of course, when you are older, even 80 or 90 years old, it's still possible to have breast cancer.
But if I ask you, Doc JT, when it comes to risk factors or symptoms for that matter, ano ang mas dapat mas observant ang tao with?
Symptoms for breast cancer: there's breast mass, there's redness, there's rash, there's nipple inversion, there's axillary nodes. But these are actually a bit late symptoms. That's why I think all of us here agree that we are going to push, and we need to push for early screening.
Now, Nicoy, Doc JT brings up a good point. How important is it that the correct information is given for our viewers or those interested in knowing about breast cancer? Can a group like I Can Serve provide that information para hindi na maguluhan yung mga tao trying to look for Dr. Google?
Yes, that's one of the thrusts of I Can Serve also. It's to dispel myths. It's to dispel myths about breast cancer because up to now, despite the many information, there are still myths that women come across and tend to believe.
When we return, we'll find out what it's like to live with and survive breast cancer. So keep it here on MedTalk, Health Talk. And welcome back to MedTalk Health Talk. Now, still with us is Nicoy De Guzman, who is a breast cancer survivor and the president for I Can Serve Foundation. We're also joined by Dr. Joseph Thomas Noriega, who is a board-certified breast surgeon from Asian Hospital and Medical Center. Nicoy, let's talk about your journey with breast cancer. What was it like when you first learned of the diagnosis? What prompted you to go to a doctor?
Well, that was divine intervention because I was relatively young. Though my mom and my grandmother got it, I was aware of the disease, but I wasn't thinking that I would get it that young. I was 28 years old when I had it. Divine intervention, my son kicked my breast. But again, dispelling myths, I didn't get it from that, all right? There was that mass already that I just, I held it and yeah, I kind of had a bad feeling about it.
What was your mind like at that point? You still did not know that you had a diagnosis of breast cancer, but like you said, you sort of had this off feeling already.
That hunch.
Yes. What were you telling? What types of thoughts were you having at that moment?
I think at first it was still denial that I don't think it is breast cancer, it probably just a mass. Hopefully it was benign. Yeah, so at that point I still didn't know naman, so I just didn't really think about it much. Yeah, but I was scared definitely. Because yeah, there's a big possibility that it is breast cancer.
Now, Nicole, let's go forward. Na-diagnose ka na, the treatment protocol was laid out in front of you. What was going through your mind now? Na this is it. This is the challenge that you're facing.
First of all was acceptance. Yeah, that like it's more of like finally it's here. Probably again because of the incidence of breast cancer in our family. Yeah, but then. From that point forward, it was more of really just surviving, getting through the treatments. I know chemotherapy would be hard, right? My mom did have chemotherapy, but she went through another protocol at that time. I think it was cobalt, so it was it was harder. Yeah, and but I just really wanted to survive because with my first diagnosis, my son was just 10 months old. So I know I really had to give it all I got and to just really get better. Cooperate with the doctors, receive all the needed treatments, and just really get better.
Now, I'm sure, Nicole, you've had a lot of challenges during the course of your treatment, but were there any challenges that really stood out, that really took a lot out of you really to get through?
I've always had long hair, like all the way to my waist, and losing that hair was really a lot for me. I think that's where most of the tears came from, losing my hair and being bald and everything. I don't think there's that much insecurity from losing a breast. Though I do not discount what other women would be feeling about it. Yeah, but for me, for the physical aspect that people will see from the outside is I think it's me losing my hair.
Doc JT, Nicoy's experience with breast cancer and her treatment is individual as her own, but a lot of people think that the treatment is the same. Is this the case? Is there more than one type of breast cancer?
Yes, definitely. So breast cancer, I always explain to my patients that breast cancers have different personalities. So if you diagnose patient A and patient B and patient C, not all of them will receive exactly the same treatment. Most of them would probably receive some form of surgery, starting with a biopsy, some sort of surgery, a lumpectomy or a mastectomy with or without reconstruction. But some will not have chemotherapy, some will not have radiation. This is precisely because they have different personalities, different aggressiveness and different stages where you discover them. It varies as to treatment, it varies as to timing of the treatment, and it varies as to the complication.
Now, Doc JT, let's talk about how that is determined on the stage in which the cancer is first detected. Now, a lot of people may be aware of breast ultrasound, which is okay. A mammogram is okay as well, but combined gives the best information for a doctor. Could you talk more about that?
Generally speaking, when you combine the ultrasound and mammogram, it gives you the best possibility to detect these lesions. And it is available in our country. Most hospitals have it. And by doing it, then you discover the breast cancer early on.
In Nicoy's case, Doc JT, Nicoy mentioned her mom had it as well, breast cancer as well. She had it as well. What type of cancer are we, what personality of cancer are we talking about here?
Generally speaking, there are three types of breast cancer. There is genetic, there is familial, and there is sporadic. When you say genetic, it consists of around 5 to 10% of all breast cancers. You have the gene, you have the mutated gene passed on from a relative to you. And then you have familial breast cancer, wherein you don't have the gene, but you have lots of relatives, your mother, your daughter probably, your grandmother, but you don't have the gene. And this consists of around 10 to 15%, more or less. And then the rest is sporadic, which means that you will be the first in your family to have breast cancer. So that's around 80%.
Now, Nicoy, hearing that, do you think before you were diagnosed with breast cancer, you had that knowledge, that information that it was a familial type? Do you think it's a challenge nowadays to have that information, especially for the familial type of breast cancer, that they just aren't aware?
Since my mom and my grandmother had it, I was kind of aware of my risk of having it. And I was already doing my self-breast exam quite early also. And actually my second diagnosis, I was the one who already felt the lump. Okay? And I think this was because I was aware and I really wanted, if ever it was gonna come back, which, well, it did, I would like to catch it early.
Could you talk about what it was like when you were diagnosed the second time? Was it just as hard as a hit as the first?
It was shocking because as far as I'm concerned, I did all the possible treatments during the first one. And I was already used to a single-breasted life, more or less. And then suddenly, here it is again. Yes, it was still shocking. But again, I knew it was early on. It was kind of early on. So I was confident. And probably, I think I can say that I wasn't as scared anymore.
That's very good to hear, because that early detection, when you were diagnosed for the second time, that's what we'll talk about after the break, because early detection and screening are great tools in fighting breast cancer. More on this when we return. So keep it here on MedTalk Health Talk. When it comes to breast cancer, self-testing, early detection, and screening can make a huge difference. Now, still with us are Nicoy de Guzman, breast cancer survivor and the president of I Can Serve Foundation. Also joined by Dr. Joseph Thomas Noriega, who is a board-certified breast surgeon from the Asian Hospital and Medical Center. Now, Doc JT, let's talk about a very important part here, which is trying to catch breast cancer as early as we can. And one of that is screening. So let's talk about that. What are the best screening tools in detecting breast cancer early?
I think we should start off by doing self-breast examination. In your 20s, you should train your hand to feel your breast, be familiar with your own body, be familiar with your breast, because you should know the topography of your breast. This is the only way at that early age that you can detect any possible problem.
Now, Nicoy, when it comes to screening, how important does I Can Serve stress those early detection tools?
We go down to the barangay level for our project Ating Dibdibin, wherein we teach barangay health workers how to do the proper breast self-exam, and then to the women also of that barangay on how to do it, so they're able to get familiar with their breasts and most of all the changes that could happen or are happening on their breast.
Yes, that is correct. Doc JT, how often should a self-breast exam be done?
Ideally, you should do it monthly, 7 to 10 days after day 1 of menstruation.
Now, Nicoy, nowadays, a lot of people need to be encouraged to get the proper treatment for breast cancer. What can you do, or how can I Can Serve be there to be part of the solution?
We are made up of a group of women who really advocate early detection, breast self-exams and everything, and all the tests as well. And we really like to inspire them and be able to teach them the right things as well, and to really get yourselves checked. Whatever age you are in, you still have to have yourself checked. Whether if you have a feeling that it's in your family, the genes are there or not, still have yourself checked. And they can simply go to our website and get all the information they want. We also have a big network of hospitals and doctors where they can have themselves checked as well.
Now, when it comes to the treatment or the side effects of the treatment for breast cancer, it depends per individual, Doc JT, no? But what are some of the more common side effects of, let's say, breast cancer surgery or even chemotherapy, as in addition to what Nicoy already mentioned earlier?
Okay, for breast cancer surgery, it's more of the immediate complications, such as possible bleeding or possible infection, but these are quite rare. Okay, for chemotherapy, of course, there is the most common, like nausea, vomiting, and then of course hair loss. Okay, and loss of appetite, changes in the body overall.
Now, still talking about trying to get the proper treatment, Nicoy, what do you think are some of the reasons why a lot of Filipinos don't get the correct treatment at the right time?
Well, number one is they're really not aware. All right, not aware that if ever there is a lump already, have yourself checked. Like they wait for it to just be gone one day or whatever, or just get checked when it starts to hurt. Yeah, and so it's that. And then they have this thinking that cancer is a death sentence. It's not. The more it's caught early, the higher chances of survival. So I think basically it's, and another thing is when they find out, I think it's the cost. If ever one gets diagnosed with breast cancer, it's the cost and how to get over that and how to get the possible treatment.
Okay, so that's very good. So definitely it affects everyone, the cost with regards to that. But let's talk about that a little bit, Doc JT. When speaking about the cost of treatment being a hindrance to getting the proper treatment, would you say that it would cost even more further down the road if it was left to progress?
Definitely. So the earlier you detect it, not only will you have the benefit of a higher survival rate, but the cost would be kept at a lower level compared when it progresses. Because when it progresses, then a lot more medications may be given, a lot more treatments may be given, a lot more surgeries might be done.
Now, Nicoy, we've been talking about those affected with breast cancer, but the reality is, those who have breast cancer, there are so many people around them who love them a lot. But sometimes, because of their lack of knowledge of the disease, with no fault of their own, they distance themselves because they just don't know how to act around someone who is diagnosed with breast cancer. So my question for you is, how can someone be supportive towards someone who has been diagnosed with breast cancer, but at the same time still being sensitive of the matter?
One thing that really helped me get through my 2 bouts with breast cancer, I think, was the support of my family. And I cannot stress that too much. There is a lot of emotional support that has to come in. Yeah. And being there present also physically with that cancer survivor is a lot of help. A lot of help both emotionally and physically as well, because really we get really weak from the treatments and everything. So having someone there, yeah, that's the thing with Filipino women. wherein we're just so used to fixing everything for everyone that when it comes to us, it means a lot to us when other people, other family members are there.
Thank you very much, Dr. Joseph Noriega, and of course, Nicoy de Guzman, for being with us, sharing your story, your life story with everyone out there. Now, with breast cancer, awareness and early detection can really save lives. So it's always important to stay informed, know the right information, and of course, know your body, know how to do the tests on your body yourself. So I'm Dr. Freddy Gomez, and thank you for joining us here on MedTalk Health Talk.